UST Hospital Suite 541 Clinic Division Building, Lacson Avenue, Street, Manila. Dr. Joe is distinguished in his field and has been part of many groundbreaking milestones, including participation in the first successful heart transplant in the Philippines in 1994. He continues to practice cardiovascular and thoracic surgery and has expanded his practice by incorporating the functional medicine approach into his practice. Firm believer of Kyani.
Our speaker for tonight is an expert in cardiovascular and thoracic, and he is a fellow of American Surgeon and Philippine Society of Surgeons, and then he also part of the team who conducted the first successful heart transplant here in the Philippines. Are you ready?
Yes.
Okay, now let's all give it up to Dr. Joe Yamamoto.
Part was that the ones who attended in this afternoon's session were actually known to me. So they were, well, two of them were 3 or 4 years my junior in medical school. So that in a way helped. But the success story that we are probably acquiring in terms of propagating about Kyani, it's not so much about the product and all. But you see, not too many doctors nowadays are onto this functional medicine. So if you talk about functional medicine, you will probably be asking, what is functional medicine? And what has a heart surgeon, a lung surgeon got to do with functional medicine? It should be the realm, it should be in the field of internal medicine. But really, we are at the receiving end of patients that cannot be managed or handled medically anymore. So the sequence, if you're talking about heart disease, coronary artery disease, the #1 disease in the world today, not probably not just in the Philippines but in the United States, at least that the one that warrants a surgical intervention is really coronary artery disease. And guess what? The #2 is stroke. So heart disease, coronary, and stroke are just a different manifestation of one big problem, which is vascular blood vessel problem. So if it is blood vessel problem, it cannot be argued anyway than saying, if it is blood vessel, then it must necessarily be an abnormality that affects any and all blood vessels. That is why, if you talk about coronary artery disease, heart attack, sasabihin niya, it's a disease of aging people. It's really partly yes and no. The mere fact that the #1 epidemic, do you know what's the #1 epidemic in the world today? Can you make a guess? It's not AIDS. Sisiyo yung AIDS. Not even hypertension. Huh? Not even cancer. Diabetes is part of the problem, but that's not the #1. I'll tell you, you least expect it. Obesity is the #1 epidemic in the world today. The food that we eat is contributory. So if you are in the fast food business, you might be displaced by functional medicine. Okay, so functional medicine is, while look at the topic, introducing functional medicine into clinical practice. But since you are not doctors, I will try to let you into the mindset that is going in people like myself who realize that the way to practice medicine or to promote health is really what I said, promote health. So that what is that going to achieve? To avoid lengthy, long-term, expensive treatment. When you enter into a coronary bypass or stroke, you are probably asking to be shelling out millions of pesos. If you are a patient who is diabetic and you end up having blindness, stroke, or Parkinson's, Alzheimer's, cancer, or even kidney failure, ang tawag din ubusan ng pera. Because you know people that have had dialysis and there is really no way of getting out unless before they have the dialysis they will have kidney transplant. But diabetic patients are not the best candidates for kidney transplant. You know why? It is because what happens inside the blood vessels are the explanation. So, Hindi ba, kung gusto mo maging healthy, you are actually acquiring a quality of life. Di ba? Quality of life. Di ba? Who wants bad quality of life? Who wants good quality of life? Lahat tayo, no?
Yes.
Dagdag natin, good quality of life where there is financial security. Ganda yata ang pakinggan, no? Gandang pakinggan. So, anyway, this is what our intention is. As a physician, I realize that there is really a limit to which we can do and practice medicine. Kasi mas maganda sana na ma-arrest mo yung bago pa sila magkasakit. How I wish medicine is practiced that way. But it's not. And so this is now a functional medicine. But by the way, this is not only coming as an idea in the Philippines. This has actually started abroad, mainly in the United States. Because sila mismo, they realize that the world's most expensive healthcare is in the United States. But if the quality of medical care or the receiving end, mga pasyente, in terms of medical care, then America is one of the lowest compared to the industrialized nation. Mas advante pa in terms of benefit yung mga nasa industrialized countries in Europe and Canada and Australia because of the socialized medicine. In America, it is a commercialized medicine rather than socialized. So, this is actually addressing it as a 21st century medicine. And we're not talking here 18th century or 19th century. We're talking here about 21st century. So, the application of the knowledge that has been gained in the last 20 years is being applied in functional medicine. Sasabihin nila, hindi naman tinuturo sa Pilipinas yan. Yes, hindi pa. But in the United States, there are actually major hospital institutions that, in my way of looking at things, if I mention to my colleague doctors and say, do you know Cleveland Clinic? Yes, because this is the number one in terms of heart surgery. I trained in Texas Heart Institute, but Texas Heart Institute will probably be number 2 or even number 3. Cleveland Clinic is the number 1. I also trained in another institution that will probably be in the top 10 of cardiac surgery, and that is Washington Hospital Center. But the number 1 is Cleveland Clinic, and they have a functional medicine department. If you talk about Harvard, you know Harvard?
Yes.
Harvard has a functional medicine department, as well as Johns Hopkins. So you're talking about those big names, big places in the United States, where they are actually allocating proper attention and focus on functional medicine. Kanina, kinuwento ko sa mga doktor na nakinig sa akin, siguro naintindihan nila yung message na sinabi ko kasi magsasign in daw sila lahat eh. But what was my message? Tinanong ko kasi meron mong estudyante galing UST, mga contemporary ko halos. Sabi ko, you remember one of our professors who graduated from Tulane University? May narinig ba kayo Tulane University sa Amerika? Totoo? Saan ang Tulane University? Ha? Hindi, sa Louisiana. Sa Louisiana. But anyway, I don't take it against you na But Tulane University is probably one of the top 20 medical schools in the United States. However, this is something that is very, very new. In their first year in College of Medicine, they are teaching the medical student how to cook healthy. Wow, parang culinary school. But they are teaching them because they understand the importance of good diet and functional medicine. And guess what? I think in the next 5 to 10 years, they will become very, very important in medical schools. So, ang ibig sabihin ng functional medicine, tinitingnan mo yung biologic causes of the disease. Example, obesity and diabetes. If you are obese, you're likely to be diabetic. Some diabetic are not obese. But more often than not, people who are obese will be diabetic or at the very least, pre-diabetic. Hindi nila alam na diabetes sila, pero alam nila mataba sila. Do you realize in the United States alone, today, they have actually, more people are getting fat and fatter and fattest. And not only that, when they talk about obesity today, you are looking at a major source of medical problems that will actually result in any and all of those complications. You name it. Ano ba mga diseases na associate nyo sa aging? Diabetes, o yun, obesity. Ano pa? Arthritis. You probably see it in a diabetic obese patient. Parkinson's, cancer, cardiac, stroke, kidney failure, you name it, it's there. So, there are actually medicine or genomics, your genetic factor, and systems biology leading to diagnosis, treatment, and ito pinaka-exciting. Reversal of disease. We have never spoken about reversing disease. We are probably talking about curing cancer, curing coronary artery disease, curing and preventing stroke, but never about reversing disease. Today, for the last 20 years, there are actually reports of doctors aggressively pursuing programs that can reverse coronary artery disease. Very compelling, very convincing. They have shown coronary angiogram of people who cannot be operated on. And yet, when they started putting them on a plant-based diet, the coronary arteries improved as much as their nutritional status improved. So that is really what is happening in functional medicine. Look at this. Tayo pamilya tayo sa puno, di ba? At ugat. Ang practice ng functional medicine, ito yung medicine ginagawa naming mga doktor sa taas. Kung ano yung puno, ano yung bunga, ano yung dahon. Kaya pag meron kang heart disease, punta ka sa cardiologist. Pag meron kang cancer, punta ka sa oncologist. Or kung ano ka, cancer surgeon. Kung may anxiety ka, punta ka sa psychologist or psychiatrist. Pagka meron kang irritable bowel, gastro, di ba? Autoimmune. Eh di sa automechanic, autoimmune eh. Hindi, autoimmune, you go to a host of siguro mga immunologists. Depression, kasama anxiety, thyroid, di ba sa endocrinologist, hormone imbalance, endocrinologist, diabetes, endocrinologist. Pero that is the way of looking at things. Pero ang karapat dapat na pananaw dito, ano ba yung kinaugat ng lahat ng yan? Saan ba nagsisimula yung lahat na yan? Ito ngayon, itong pinag-uusapan sa functional medicine. Dok, hindi mo niya tatanong kung paano nagsimula itong diabetes. Kundi, blood sugar mo abnormal, bigyan na kitang gamot. Dok, anong pwede kong kainin? Pwede mo kainin lahat. Kasi bakit? Binibigyan ka ng gamot eh. Tas ang pamilya? Meron ba kayo nakita o kilala na, kamag-anak, kapatid, na ginamot ng diabetes na sa kagagamot at mahusay ng mga gamot, ngayon na hindi na diabetic? Ha? Bakit? Ano wala na? Usa? Huwag natin yun. Baka naka-video, baka ako sana ko lang kasamahan ko. Ano? Bakit? They continue to be diabetic. What we're trying to manage are the effects of diabetes, which is an abnormal blood sugar. But what we want in a functional medicine is go to the root cause. Baka meron yung poor digestion, baka meron siyang toxic idea, baka may nutritional deficiency yan, or may inflammation, or mainly poor diet. These are the explanations. So kung yan ang dahilan, bago sino magka-diabetes, dapat kinokontrol mo na yan. Di ba? Correct. Okay. So, susunod. Pag naintindihan natin yan, walang pinag-iba yan. Kung dispalinghado ang sistema ng katawan nila, ano yung epekto? Sakit. So, paano mo siya magagamot? Ibalik mo yung balance. Di ba? Kung kayo accounting, di ba, ganun balance. Sino ang accountants dito? Sa accounting, o yan. Di ba? Kinakailangan balancein yung account. So, that is the treatment. Anything that there's an imbalance within the body will result in the disease. Our ancient doctors knew that. The Egyptians know that. The Chinese knew that. The Indian Ayurvedic doctors knew that. But we, in practicing in Western medicine, said, no, what you cannot demonstrate cannot be appreciated as the real cause of the disease. But today, it has changed. The dynamics, the understanding of disease and causation of disease has changed. That is why, pag sinabi nyo, luyang dilaw, kung dati, paliwalain, nilalagay mo sa paggawa ng karya. But today, curcumin, turmeric is considered a very effective anti-inflammatory medication. Di ba? Ang palaya, tatawanan ang palaya. Ano naman ginagawa niya? But now, we know that ang palaya can actually control your blood sugar. And what else? Ang dami ko alam. Nabundi. Ngayon, tinatawanan namin yung dati, nabundi. So dati namin, meron kami professor, yung kanyang sistema is about vitamin B17, Latril. Sabi namin, ako, tinan na lang natin itong lecture, pero hindi natin apply yan. Bakit? Vitamins yan eh. Eh, kailangan natin matutunan how to do a surgery. Kaya kasi gusto ko, servano ko eh. Pagka na yun, gusto na parang papasa na lang natin itong kurso na ito. Biochemistry, naku, hirap intindihin yan. Eh ako gusto kong biochemistry kasi exempted ako. But most students will not want biochemistry. Hindi gusto ko maging cardiologist. What does biochemistry got to do with cardiology or anything and everything? So, this is really about everything. So, sabi nitong doktor nito, si Snyderman, sabi niya, functional medicine is a core people medicine. Personalized, preventive, predictive, participatory. Sa lahat ng sinabi niya, doon ang nag-attract sa akin is the following. Participatory. Who is participatory here? Or what is the participatory part here? The patient is now participating in his or her getting well. So, di ba na-empower mo mga tao? Most of the time, we are actually telling the people, akong doktor mo, sundin mo ako. Eh, dok, pero ganito na ba? Akong doktor, sundin mo ako. Kung hindi, lumipat ka sa ba. But now, functional medicine is encouraging. Now we talk about how you can participate, and you can never intelligently participate if you do not have a working understanding of what it is to do functional medicine. Di ba? Okay, next. Etong gusto ko rito. Functional medicine is defined as patient-centered. Ang mahalaga yung pasyente. Kaya lang, ang doktor ang nagdadirect. Especially if both of them are participating in the treatment of the disease. The more serious the disease, the better should be the participation. Ang tinatanong, ano pa yung sakit niya? Dapat pala ganitong tanong natin, bakit siya nagkasakit? The why of the disease, the why of why people become ill in the first place. Okay? So, this is what this slide is telling us. Instead of, ano yung symptoms niya? Ano yung mga symptoms niya? Ano yung bukol niya? Anong klase? Anong klase? Ang tanong din, bakit nagkaroon siya ng mga sakit na yan? I think this is what we should be in medical school. We should be teaching our medical students. So, ang kagandahan ng functional medicine, hindi mo kailangan mag-specialista. Pediatrician, internal medicine, ENT, Opta, whatever. But the is the whole system's application because a person is one person made up of many systems. So, by putting everything in that light, you understand why it is important to understand functional medicine. Kung ako doktor yan, titignan ko system biology, dapat naintindihan ko yung workings ng katawan na hindi ko lang tinitignan masakit ng yung braso, and then specialty ko kanang braso. Kaliwang braso, hindi ko na specialty yan. Ano ba, kanang mata? Hindi ko na specialty pag kaliwang mata. You can become so over-specialized that you forget and neglect that we are talking here about one person who is the sum of many parts and many systems. Correct? Alright. So, contrary to what people think na, yun, sinauna pa yung mga ginagawa sa functional medicine pa yun, in the last 20 years, the burden of the medical sciences are here. Last 20 years. For example, you will hear in a little while, the product called nitric oxide was discovered only in 1998. We know that people who were having chest pain, pag binigyan mo ng nitroglycerin, alam na ba yan, narinig yan, nitroglycerin, lalaging gamot, lalaging sa lalaging dila, pawawala sa sakit. Totoo nga. That is nitroglycerin, which has been here for the last 100 years. But it was only in the last 20 or so years that we understand that the reason yung ugat nagre-relax, nag-improve ang circulation, nawawala ang chest pain ng mga pasyente may angina, is because of nitric oxide. Discovered and actually credited for why these medications work in the first place. Nitric oxide, you'll hear more and more about. Ano ba yung steps na in-emphasize? 7 lang yan. Pag naintindihan yung 7, pwede na kami practice ng functional medicine. Boost your nutrition. Tayo kumakain ilang beses sa araw? Ilan? Yung totoo. 3 plus. Para may service, may taxes din yan, ba? 3 plus. Dalawang merienda, si plus. Pagka napuyat pa sa gabi, meron pang kapon. 6 na beses. That is how it is. But if you sum up, doon sa kinain mo, pinakakain mo isang araw, ilang kaya doon ng gulay, ilang kaya doon ng prutas. Naku, ano yung prutas? Ano yung gulay? Di ba? Because we hardly eat it. Dr. Yamamoto, ikaw, you are talking about health. How many times do you eat vegetables? 2 or 3 times a day. But that is well below the 5 to 11. Bakit 5 to 11? Well, after this experience, why a variety of fruits and vegetables is good so that you will get the right nutrients. The more colorful your fruits and vegetables, the better. That has been proven. Di ba? Okay, so, babalikan natin yan. Regulate your hormones. Yung hormones, hindi lang yung kung bakit meron kang imbalance ng estrogen, progesterone, or testosterone, or thyroid hormone. But do you realize that many things that we do in life will have an effect in its hormones? For example, we are chronically stressed. Yung trabaho niya, palagi kayo stressed. Tumataas yung cortisol ninyo. Cortisol causes you to have hypertension, diabetes, and a lot of other degenerative diseases. It can actually kill you. For example, di ba meron tayo sinasabi namatay, sinong namatay na artista noong December? Si Princess Leia. Di ba? Carrie Fisher, di ba namatay? The day after namatay siya, sino namatay? Yung dati, nanay niya. Di ata niya pinabasa yung news eh. So there is a sympathetic reaction which is probably because of a bereavement principle. Bereavement principle ang tawag nila. Kasi sa sobrang lungkot at bigati, namatay. It can happen because it's a good example. So, is it hormonal? Possibly hormonal. Possibly what? Cortisol, stress hormones. So that it can actually make you appreciate as a way of example. Reduce inflammation. Ang ibig sabihin ng inflammation, hindi lahat ng, alam niyo yung pigsa, no?
Yes.
Nagkaroon na kayo ng pigsa?
Yes.
Pag sinabi nyo hindi kayo nagkapigsa, hindi kayo tao. Di ba lahat tayo nagkapigsa? Pag nagkapigsa, komportable ba kayo?
Yes.
Nako, hindi ba sakit? Okay, so, that is inflammation. Pero hindi lahat ng inflammation ganun kasing sakit ng pigsa. Why? Because there is an inflammation that is raging inside our body caused by the food that we eat, the medications that we take, or even the toxins that are actually finding its application or rather entry into our body. That is an inflammation. Inflammation, in point in fact, to underscore and emphasize, is the main reason why we have all of this or most of these degenerative diseases. If you tell me coronary artery disease, may background yan in inflammation. Yung Alzheimer's, meron yung background in inflammation of your brain tissues. What about cancer? It starts with inflammation, damage to your DNA. So, and so on and so on and so forth. That's why, mukhang reasonable strategy, kontrolin mo yung inflammation, i-identify mo muna din, control inflammation. Functional medicine is about that. Improve your digestion. Sino dito kumakain ng Yakult? Ha? Tingnan mo. Paano kung frozen? Kasi kakainin mo? Oo nga, no? Pag frozen. Anyway, whichever, whether you drink it or you eat it, it's still the same. It's probiotics. Of course, we can vary. We can differentiate. I don't recommend Yakult for the simple reason that medyo matamis masyado. The best probiotics are in capsule forms or kung kayo ay kumakain ng sino mahilig dito ng kimchi? Oh, kimchi. Kaya tataas. After tonight, tataas ang bentahan ng kimchi. Kasi very good. Fermented foods are good in probiotics. Okay? But anyway, it improves your digestion. Today we know, and we are getting to know more and more, that friendly bacteria in your intestines can help you control many of the diseases that you are having. Ayan, so meron indigestion, sobra sa kain, pag-gain ng weight, diabetes, it has a relationship in the kind of probiotics that you take. So anyway, sundan natin. Detoxification. Sabi niya, punta tayo sa ganito, mag-detox tayo. Di ba? Ang iba, nilalambat iba. I have nothing against that kasi there are scientifically based reasons to do that. But the most important detoxification are taking the right supplement. And you will realize that Kyani is one of those best detoxification. Okay, so, that said, enhanced energy metabolism. Hindi lahat ng kinakain mo is producing the right energy. Sometimes if it is not absorbed It will not produce energy. If you eat the wrong foods, it will not produce energy. It will be all wasted. A lot of times, if you eat bad food, it will have bad effect. One of that is what? If you eat a lot of processed food, then it will result in obesity, diabetes, and even cancer. So, we're discouraging processed food. Not that we are against McDonald's or Jollibee or anything. But, the reason why we say it's because it will actually disturb the ability of the body to absorb metabolism. Sino rito sa mga nabuhay sa panahon na kumakain ng star margarine? Uy, star margarine. Uy. Kumakain ba kayo ng star rice? Uy, pinakain kami ng nanay ko ng star rice. Sinasahog niya sa tapos. But actually, star margarine is trans fat. I would not recommend it. Okay, again, that is scientific data. Sino rito yung dati, mga bata pa sila, ng mga liebo 1950s, 1960s, inutos na sila ng nanay ng bumili ng puriko. Uy, yeah, thank you for being honest. Puriko. That is another trans fat. Kasi this is vegetable oil na nilagyan ng hydrogen so it becomes solid. So that is trans fat. Do you realize that in the many of the fast food that we are eating, when they fry French fries, that is with trans fat. Pag sinabi nila, no trans fat, mag-iisip ka dahil, yung mga French fries na niluto, trans fat ang ginagamit nilang mantika. So, you know better after tonight. Yan. Soothe your mind. Pag masyado kang stress, talagang problema. Ano ba talagang pinagiging problema mo bago ka matulog sa gabi? Yung pera. Sabi nila, parang mga doktor, sabi niya, yung ophthalmologist, alam mo yung ophthalmologist? Sabi na, nakita siya ng man. Tinanong niya yung isang duling. Sabi niya, ano yung tingin mo? Doble kita o doble kita mo pala eh. Di ba? Paano kung bulag? Walang kita. Di ba? Paano kung halimbawa mayroong errors of refraction, malabong kita. So balikan natin yung kaisipan. Di ba? So, obviously, when you are stressed out, you will create a lot of imbalances. Ikaw ba pag na-stress ka? Anong ginagawa pag na-stress ka?
Pupunta po sa nature ko.
Nature. Lumalayo ka lang. Huwag kang tataw sa bangin, ha? Tama ba? Do you realize that all of us, when we are tense, what do you do? Women?
Eat.
Eat and over-eat. Di ba? You get to eat. Bakit? Nag-compensate ka. Because a lot of times, stress creates cortisol release and all of those other neurotransmitters and hormones that will create an appetite build-up. Yeah. Pag napuyat ka, the best example of a stressor for everybody is pagpuyat ka. Pag napuyat ka, anong pakiramdam mo? Gutom. Puyat tayo rito eh. Kakain tayo muna. Kasi talagang nakakagutom yung appetite ng di ba, sa puyat. Totoo. Because may hormonal basis. Ako, sa pambira, pwede mo naman control yan. But when I started looking at this, I realized that there is a hormonal balance or imbalance that is responsible. In the United States today, hindi na nila sinisisi, ang taba mo kasi, lakas mo kasi kumain eh. Hindi na. They consider obesity as an illness that has to be treated. Totoo nga naman eh. It's the kind of food that happens. When you start eating, sometimes people will still eat despite the fact that they are drinking Diet Coke or Diet Pepsi or whatever. Because when you eat all those soda with aspartame, yung metabolism mo nagbumababa. Instead of burning, they slow down your metabolism and actually disrupt the hormone that controls your suppression of appetite. Akala mo kumakain ka, dapat pag kumain ka, na-stretch yung stomach mo, yung tiyan mo, dapat tumitigil na parang safety net yan eh. Pero hindi. Nilalansin niya ang utak mo siya, kaya mo pang kainin, kumain ka pa. In effect, ano ang nangyayari? That's why people build up with obesity. And functional medicine will seek to appreciate and understand that. The real causes of disease. Gusto ba niyo malaman?
Yes.
Siyempre. Dito sa mga causes of disease, may kinalaman ang Kyani. Gusto niyo malaman din, di ba?
Yes.
Ayun. Bakit gusto niyo malaman? Para happy. Okay. Tama, tama. This is another honest person. Poor diet. Wala tayong description dito. Poor diet, di ba?
Nako, grabe.
Grabe. Yan. Yan ang iwasan ninyo. Paano kung meron kayo na-confront kayo na maraming ganitong klaseng pagkain, anong gagawin ninyo? Padala niyo sa Kyani office, maraming gutom dito. After tonight. Ayan, stress. Nakakabangag, nakakabaliw. Hindi na magsasalita. Mikrobyo. Di ba? Here causes disease, infection, and whether virus, whether it's a bacteria, meron pang tinatawag na fungi, meron pang iba dyan, rickettsia. We can't classify it under microbes. So, there are many ways. The best way really is preventing. To avoid getting sick in the first place, you know what to do? Have a strong immune defense system. Di ba? Okay, sa susunod, toxins. So, ang dami nating tubig, karagatan, are already contaminated with what? Naglipa na yung mga small gold mining. And when they start to extract the gold, what is it that they use? They use a lot of mercury and acid to extract the gold. So, saan pupunta yun? Sa seawater, sa river, and then to the sea. And so, where would the rainwater bring those toxins? To the sea. Ano kaya nga mangyayari doon? Matutunaw kaya yun? O kakainin sa mga vegetables na underwater vegetable matter sa dagat? Kakainin, maiinom ng mga small fishes. And so when you eat tuna, you have a danger of mercury poisoning. Allergens. Di ba? So much can be said about allergy. Saan kayo allergic? Sa konting pera, maraming pera. Sa konting pera. Tama, yun dapat ang sagot ninyo, konting pera. But most often, we are allergic to food, we're allergic to some contact material, cosmetics, etc. And so, a lot of that, allergies today. Many of that, have you ever been curious, bakit kaya, kung kailan naman ako tumanta sa ano ko ng asthma? Huh? Has it occurred to you? The reason why is because of bad diet. But that's a topic of another lecture. Para pagbalik ninyo later on, another set of lecture. But just to show you that these are the things that you need to learn. Single gen. Nilagyan ko ito ng parenthesis kasi sabi nila, genetic. Siguro sa totoo lang, 5% lang naman ng mga sakit sa buong mundo today are cause of genetics. But do you realize that even if you have a genetic code for that kind of disease or cancer, it does not mean that that person will become cancerous. What can change? What can change the expression or manifestation of cancer? Diet. Ang tawag namin doon, epigenetics. Changing the way, the genetic predisposition of a person by way of changing the environment, especially food. That is called epigenetics. It's an exciting work in the United States today. They are focusing on the kind of food that you eat. Okay? Kinukwento ko sa mga anak ko, one of our earliest son is there in the United States practicing family medicine. Yung second daughter namin is going to the US for training. Sabi ko sa kanya, anak, ganito yan. Sa Amerika, madaling tumaba, madaling maging healthy. Kasi everything is accessible to you. But it is really a matter of choice whether you want to become healthy or you want to become ill. So, finally, or well, not really finally, but if you are going to talk about putting people on the right road to wellness, ito yung target ko. Dapat blood pressure mo less than 120. Dapat yung weight mo less than 25 kilograms per square meter. Dapat yung circumference mo kung lalaki ka ay less than 34 inches. Kung ikaw ay babae, dapat less than 32. Doon ko na ng 32. Kita yata sinusukot niya doon. But just the same. So, fasting blood glucose less than 100. You see, 15 years ago, we would probably say, anong blood sugar mo? 120, normal ka. Today, if you tell me your blood sugar is 120, diabetic. So, the changing standards is because now we understand better what the importance of elevated blood sugar is. Cholesterol, LDL, bad cholesterol, good cholesterol, triglyceride, and then inflammatory marker. Okay? Hindi na ako magpapalalim dyan kasi you will ask me later. Pinoproject ko lang ito because with permission, this is one patient who came to me last September because of 3-vessel coronary artery disease. He showed me the coronary angiogram. Tinignan na siya ng another surgeon. Sabi niya, kailangan ng operation. But when I started investigating, I said, meron ka bang nararamdamang chest pain? Ikaw ba madaling mapagod? Umihingaw ka ba? Paghiga mo ba para makaramdam mo, nalulunod ka? So sabi niya, wala ako dito. Kasi compose ko rin ito eh. Wala po dito. Oh, okay. Kung willing ka, I will schedule for surgery right away because what am I going to control? So I said, what I'm going to do is to try to say, to reverse the conditions that brought you into coronary artery disease in the first place. If you are overweight, let's handle that. If you are diabetic, let's handle that. If you have hypertension, let's handle that. True enough, by putting in place a program of functional medicine from September to end of November, from 230 pounds to 182 pounds. Good story?
Yes.
Hanggang ngayon, hindi ko pa inoperahan. Mukhang ayaw na mag-opera sa akin eh. But actually, that's the way functional medicine should happen. Not because you're going to lose in surgery, but because that is the right thing to do. Okay? So, now, to the meat of the discussion tonight. Why are you here? Because of this. Water-soluble vitamins. Excellent, natural, organic, and can have all of those effects that you can find in your brochure. I will not actually repeat that anymore. So, sunrise, kasi water-soluble vitamins. Pagdating ng gabi, sunset, fat-soluble vitamins. They are some of the best because they are produced from good quality materials. You've seen in the video, wild berries for the sunrise, sunset, yung salmon sockeye. Today, there are probably few standards by which we go. What is this? For example, if we prescribe fish oil, the one that is in the market today goes by the name Omacor. Medyo expensive and pricey, but that's one of the purest. Now comes along Kyani Sunset. And so I prescribe it. The advantage of Sunset because it has tocotrienol, which is a very powerful, the most effective and powerful vitamin E. Vitamin E. So you need a combination of omega-3 fatty acids and vitamin E to produce a synergistic effect or positive effect in health. The most important product, as far as I can see, is nitro. The reason why nitroglycerin is effective or nitrates are effective is because of nitric oxide. The reason why we are able to control our blood pressure is nitric oxide. The reason why the whole systems, all the cells of the body are humming with effectiveness and efficiency, nitric oxide. The older we get, the less nitric oxide is being produced. And that is why you see all of those disorders that are happening in our bodies today. Obviously, if you can improve the manufacture and availability of nitric oxide, what will happen to your body? Will improve or deteriorate? Improve. So, hindi ba reasonable, logical? Hindi, let us make available nitric oxide. I have already shown this in my, since I have been involved only in September, I realized that if I give my patient blood pressure medication sila, and then I give them Kyani as nitro extreme, the blood pressure is maintained. So did I remove myself from treating patients from hypertension? No. But it is a very important addition to the way I take care of patients. Now, okay? So, do you like nitro?
Yes.
Have you used nitro?
Yes.
Yan. Have you asked your husband to use nitro?
Yes.
Okay. Alright, so, sino dito unmarried?
Unmarried.
Unmarried, ha?
Unmarried, feeling virgin.
Now, depende sa level of spirituality mo, sasabihin ko, please, don't use this on your boyfriend. Improve sexual function. Tinanong sa akin ng isang pasyente kong babae, Dok, paano naman kaming babae? Hindi, basta improvement din yan. I'm not too sure about the women, but I'm sure that it does because nitric oxide is good for everybody. Men or women, young and old. But let me go back to this. Anti-inflammatory. What was it that attracted the surgeons na kanina sa sessions ko? I told you here. Two of them were orthopedic surgeons. Three of them were general surgeons. One of them was pediatrician. Look at this. Supports cognitive function. It helps you prevent the deterioration of your thinking process, your memory, and then promotes increased energy. They are using this in the United States for athletes. Nitric oxide, nitric FX. They use that to push their own physical stamina without violating the Olympic rules. Kasi it's natural. So, if you have all of these things, then let us go to how it works. Dito sa loob ng blood vessels yung endothelium. So, look at this. Nitric oxide, important in the nerve signal and making that blood vessels relax. There is another added benefit that I tell patients today. If they're not yet convinced about nagre-relax yung blood vessel, there's an important aspect. You don't want your blood to be very sticky.
Yes.
Why is it important that yung blood mo is that normal in its ability to clot? Kasi if it is very sticky, well, obviously, the stickiness of the blood and yung artery mo na nagko-constrict will be a good combination for hypertension and stroke. So, most of the time, people that develop stroke have an acute increase in their blood pressure. So can you imagine if all the people that you know, including yourself, if you have in your pocket or your purse,
Yes.
nitro extra. Amen?
Amen.
Amen. So, ang hina naman palakpak niyo sa Kyani. Yan. So, ito, recovering, if you are in the, and then immune system. The reason kaya sabi ko kanina, the reason why cancer patients will survive with or without radiation or immunotherapy or surgery is this. I can argue and discuss with all the oncologists in the world and say, why will your patients survive? Well, because we're giving them the best and the strongest anti-cancer therapy. Hello? Your cancer agents will kill both cancer cells and normal cells.
Right.
Depende nila kung ano yung lamang, cancer cells or normal cells. The more normal cells you kill,
The more
cancer rages on the patient has not survived, and vice versa. So the more cancer cells that you know, then less effect. But giving supplements like Kyani will actually work to the advantage of the patient where cancer cells are more susceptible to the medications, and yet Kyani and its products will protect the normal cells. Wouldn't that be a good thing? I will stop at this point because more or less you understand that there's a lot that you can do. But most important thing that you can actually do is to convince people not to go into network marketing, but just to convince them that there is a good set of products that can actually boost their health and help them, to regain their health if they have lost it, or to maintain their health if they still have it. So, hanggang dito lang. Maraming salamat. Magandang gabi.
Life's greatest tragedy is that most people do not value their health until they lose it.